to doctors and medical personnel. We hold those physicians and medical personnel in the highest esteem, who, in the exercise of their profession, value above every human interest the superior demands of their Christian vocation. Let them persevere in promoting on every occasion the discovery of solutions inspired by faith and right reason. Let them strive to arouse this conviction and this respect in their associates. Let them also consider as their proper professional duty the task of acquiring all the knowledge needed in this delicate sector, so as to be able to give to those married persons who consult with them wise counsel and healthy direction, such as they have a right to expect. So I'm a family physician, as you heard, with an area of concentration in women's health and a certified fertility care medical consultant. When I finished my residency, I moved to New York City, really feeling profoundly called to do so, and along with everyone else who's spoken, really touched by the call of Humanae Vitae to healthcare providers. What drove us or drew us to New York City was a couple of things. The first was that we really actually saw Catholic women and families as an underserved population in the truest sense of the word. I mean, these were families that were trying to walk this narrow way of their Catholic faith, and when it came to their reproductive health care, had nowhere to turn. I mean, no doctor that could help them, no doctor that was even willing to listen to them. And so we felt that first and foremost, we wanted to make sure that these patients had support. So started Catholic Women's Reproductive Health Center that offers all of the positive alternatives that you've been hearing about. And so my talk, the title of my talk is why Catholic fertility care medical centers should remain publicly Catholic. And as we were starting out to start this medical center, we were asking ourselves this question. Yes, we wanted to serve Catholic families. Yes, everything we would do would be in line with Catholic ethics, but how would we promote ourselves to the world? And the concern that is raised when others consider this question is, well, you might scare other people away. If you're too Catholic, they won't come, and then you can't serve them. Some people will be offended. So we really, prayed, discerned, researched deeply on this specific question. So I'm going to talk a little bit about our Gianna Center, our nonprofit that we created to help groups to start medical practices to deliver this care, but also why we ultimately decided that we did want to be public in being a Catholic center. I don't know if this counts as a conflict of interest. I'm talking about an initiative I did co-found, although I don't get any profit from it, except that I'm employed by one of our Gianna medical centers as a practicing physician. So I'll start from actually what we took in this discernment about being publicly Catholic from Humanae Vitae and from the Ethical and Religious Directives. I'll talk briefly about what the Gianna Center can offer to those who are interested in trying to start medical centers to deliver this care, and then why we decided to be Catholic, and really why we're making a pitch that we want all of us to be able to do this in a way that creates a national Catholic brand. So what you were just reflecting on, Humanae Vitae's, the 3 sentences of Humanae Vitae that I read that speak directly to doctors and nurses and those in Catholic healthcare, they really tell us volumes and volumes and volumes. We hold those physicians and medical personnel in the highest esteem who, in the exercise of their profession, value above every human interest the superior demands of their Christian vocation. There is such a, it's built into our culture, it's built into our medical training, that you check your personal beliefs at the door, and then you're there to serve your patient. And we do actually ourselves, I think, start to buy into that. But what are the demands of our Christian vocation? To know, love, and serve God, and to bring others to know, love, and serve Him. And this does not mean beating them over the head with our religious beliefs, but the call of our Christian vocation is inherent in our professional vocation. And so what are the human interests that we may be allowing to be superior to those demands, our financial concerns, our worry about what people will think about us. To me, this spoke volumes. Persevere in promoting on every occasion, he tells us. Pope Paul VI told us that we are called to promote on every occasion the discovery of solutions that are inspired by faith and right reason. Not just sometimes, not at our convenience, but it's part of our call as Catholic medical professionals. And even more, to strive to arouse that same conviction and respect in our associates. These are really actually quite tall orders, very intimidating, but nonetheless, just as he laid out for married couples what is authentic love and what are the requirements of authentic love, here he lays out for us what are the requirements of an authentic vocation to medicine. And then finally, what I think is the most resounding, striking of the three sentences: let them consider their proper professional duty, the task of acquiring all the knowledge needed in this delicate sector so as to be able to give to those married persons who consult them wise counsel and healthy direction, such as they have a right to expect. Again, he's not saying, this is a nice thing if you're interested in it. He's saying, this is your professional duty. And couples have a right. The Pope is saying couples have a right to expect this from us. It's just like, I think it was Gaudium et Spes, when they say parents don't have a right to a child, but a child has a right to be conceived through the act that is appropriate to its mother and father, to have a mother and father, a right. This is the highest level of responsibility you can lay out for someone. And for us, it is a duty to provide this guidance that they have a right to. I thought they was really strong words. The ethical and religious directives, these are largely directed towards guidance for institutional health care, of course, and they are not all-encompassing. They try to concisely summarize and, again, reaffirm the ethical standards of behavior in health care that flow from the Church's teachings, and to provide authoritative guidance on certain moral issues. But they guide all of us who are trying to provide Catholic health care. The part of the ethical and religious directives that's most relevant to us and to this conference, us at this conference, is part 4, issues in the care of the beginning of life. And again, the ethical and religious directives prohibit contraception, direct sterilization, abortion, fertility treatments that replace the marital act, experimenting on embryos or fetuses. They do encourage access to prenatal, obstetric, and postnatal services kind of generally, support for adoption, support for women who have had abortions. And then they outline as acceptable treating infertility and the ways that are okay to do that by assisting, not replacing the marital act, and then genetic counseling, induction of labor. So again, not meant to be a summary of the church, the depth of the Church's entire teaching on these things, but the ethical and religious directives do contain one positive requirement. So you can't do abortion, you can't do contraception, you can't do sterilization, but they should. This is, again, in the ERDs, to me, this lays it out as our obligation. Catholic health institutions may not promote or condone contraceptive practices, but they should provide for married couples and the medical staff who counsel them, which is all of our family doctors, our obstetricians, our med-peds doctors, possibly even ER doctors. 2 things: instruction about the Church's teaching on responsible parenthood and instruction in the methods of natural family planning. So we drew on these, and I point out what's been pointed out now many times in this conference. We were really struck by the idea that Catholic women's reproductive health care was being defined by what it doesn't do. We don't do abortion, birth control in vitro, as opposed to saying, inspired by this profound and deep understanding of the dignity of the human person and the intimacy between husband and wife, we are committed to providing patients with access to the positive alternatives. Now, there are many reasons why Catholic healthcare systems, many do. This has actually, for me, been one of the most inspiring conferences I've ever attended relating to healthcare because of what I've learned about healthcare systems like Mercy and OSF. I'm sad to say, prior to this very day, some of my worst experiences in healthcare occurred in Catholic health systems. This is a sad comment, but when I was a medical student, I was told in a Catholic hospital by an employed obstetrician that I had no right to become a doctor if I was not going to prescribe birth control, and if I was going to be a doctor, I had no right to take care of women. So this is not meant to be a scathing criticism of Catholic healthcare, because we've heard of amazing initiatives, but I think we look at it realistically, like, why doesn't it happen? And there are some very practical reasons why there isn't a Catholic fertility care center in every Catholic hospital in the country. And one of them is we're missing doctors. We need more family doctors and OBGYNs who are, I hate this term ERD compliant. I'm trying to think of like what it means to like bring the fullness of the ERDs to fruition. Those are the kind of doctors we want. There just aren't many. This care that you've heard about, NAPRO technology, fertility care, teaching of the other methods, these things take time. Time is poorly reimbursed, so there's an investment. But I will tell you, even though there is requirement in funding and investment, the support is there from the pro-life community. When we first opened the practice in New York, we were part of a Catholic hospital. It was actually the last Catholic hospital in New York City, and tragically they closed due to bankruptcy 3 months after we opened. And actually at that point, the small outpatient medical clinic became the last Catholic healthcare in New York City. But for a year after they closed, we were supported by donors. Nearly $600,000 were given to support the practice. So it means recognizing, okay, there's gonna be an investment in doing this funding, but because we're committed to this in mission, we're gonna do it. And then I think the third reason is a very legitimate one. Healthcare systems are massive and complicated. They have a lot of people who both work there and work as administrators there. That means a lot of diversity, and diversity is wonderful. But it does mean without a really specific and deliberate and intentional focus on making sure there's access to this care, it can just fail to be a priority. So the National Gianna Center for Women, as I said, we started this first medical practice in New York City. We do primary care, general gynecology, NAPRO for infertility, providing positive alternatives to birth control, abortion, and in vitro. At this point is unfortunately the last Catholic period medical center in New York City, and it's the only one that is faithfully Catholic in providing women's reproductive health care. But in 2012, we started a nonprofit that had the mission actually of helping others to establish the centers. So Pope Paul VI, Dr. Hilgers, they have this phenomenal education program for fertility care practitioners and doctors. Then doctors want to go out and deliver the care, but kind of are left not sure how to do it. How do you bill for it? How do you start a practice from the ground up? How do you structure your practice to do the case management? So we formed this nonprofit to assist with that process for any doctor wanting to establish a Gianna Center. And our goal is to have one in every diocese so that patients in at least one center in every diocese have access to this care. So it is a 501c3 nonprofit. We are actually an outreach of the Diocese of Metuchen. So as the last speaker mentioned, we actually don't go into any diocese without the permission of the bishop. So one of the first steps when a working group is interested in establishing a center is for them to reach out to their bishop and get their permission. We are part of a healthcare system. After that initial year of being supported by donors, we became part of a Catholic health system from a different state, the state of New Jersey, that really wanted to make sure this care was maintained in New York City, and so they have supported it. And then through our nonprofit, in the past 9 years, we've helped other centers to start. And we currently have affiliates in 9 different cities and 3 additional centers that we're helping along this process of starting a center. So the goal is to provide, to increase access to patient care by establishing the medical centers. So we work with doctors, we work with community groups that may not have a doctor and want to put the pieces in place for a center and then recruit a doctor. We have worked with hospital systems to establish these centers within their hospital system, or dioceses that ask us to come in and help provide guidance. And then we also provide a means of ethical oversight of these centers so that we can guarantee that every Gianna center is providing care that is completely faithful to the ethical and religious directives. So we will do things like every other week conference calls to walk them through the process of writing their business plan, putting together a board of directors, doing fundraising, practice management, billing. We have many protocols and templates that we make available to them. We do twice a month. We have a clinical call, so NAPRO doctors that are newly trained, starting to see patients, they can just call in and they'll bring their cases, and as a group, several of our longer practicing NAPRO doctors will walk them through managing these patients as the newer doctors are learning. People find that to be a great support. They can share our marketing, so each of these smaller centers don't have to develop marketing if they'd like. And then as funding allows, we will make grants. We have some minimal funding available at this point, but our goal is to make that more widely available. Because we have a national mission of creating centers across the country, we have partnered with some other organizations that have a national mission. So the National Catholic Bioethics Center, Dr. Brahani serves on our board of directors. The Catholic Medical Association has agreed to appoint one of their physician representatives to our board of directors. The St. Gianna Clinic in Green Bay, Wisconsin is working with us, again, through our board of directors. The Sisters of Life, a pro-life religious group committed to the sanctity of life, their Mother Superior, their founding Mother Superior, recently agreed to serve on our board. And the Cardinal of New York City, Cardinal Timothy Dolan, has been not just tremendously supportive, but has expressed to us that he really feels this needs to be an outreach of the church. And so we are working with him and to look at what that might look like in relationship to the Bishops' Conference. So just diagrammatically, the 501c3 does not deliver patient care, but really exists to do everything we can to simplify the process of delivering that care for providers in practice, who then provide the service to the patient. Our affiliate medical practices are all independent, so they're either owned and operated by a physician in private practice, a hospital, or if they're a nonprofit, they're overseen by their local board of directors. We don't have a required corporate structure. They are medical centers, they're not crisis pregnancy centers, though many of them collaborate closely with their local crisis pregnancy centers. They can be family practice, pediatrics, OBGYN, or internal medicine, but they must offer the positive alternatives if it is, to the degree that it's within their scope of practice. So pediatricians don't need to be doing infertility treatment, but they're seeing teenagers and need to be able to offer their teenagers access to things like NAPRO. They don't have to be nonprofit, but they do have to have a charity care policy, and their payer model is at their discretion. And then the formal requirements for being an affiliate are that they must be fully compliant with all of the ERDs, not doing anything contrary to it, but they must also offer the access to these positive alternatives. And we do require that they provide patients with access to the Creighton model system, and that at least one of their physicians become a certified NAPRO technology provider. However, because it really is a service to the church, we do welcome teachers of other methods that are evidence-based and endorsed by the Bishops' Conference to use our space for teaching. We will promote them, we'll encourage them, but they must foundationally have Creighton and NAPRO available. And then there, again, has to be some degree of a charity care policy in place. I won't go through this, you've heard the positive alternatives the whole time, but we really took the ERDs, the prohibitions and their positive requirements to define what we think our Catholic medical centers should be offering in women's health. Oops, that's the wrong way. And then, so this ability to audit actually comes through the fact that we did trademark the name Gianna and Gianna Healthcare. So any medical practice which uses the name Gianna in its name must become an affiliate. There's a formal affiliation agreement which allows them to use the name and allows us the ability to audit their practice for patient quality, care quality, patient satisfaction, and their compliance with the ERDs. Some people have been upset about this. They feel like it's not fair that you would trademark St. Gianna's name, but the purpose really is to protect that name so that when people go to a center with her name, they can trust with absolute certainty that this care is faithful to Catholic teaching. And so the affiliation agreement really is not meant to be burdensome. It's not meant to create difficulties, but it is meant to ensure this, this fidelity that motivates what we're doing. Sorry, wrong way again. This is our logo currently. I think we're probably going to do a little bit of market research and modify the actual logo possibly. But practices that already exist in a community that simply want to become an affiliate as part of this network, we don't ask them to change their name. They've already built an identity in their community, and so they simply list themselves as an affiliate of the National Gianna Center. When we help groups to start from scratch, we do require that if they're going to be an affiliate and we're going to provide this guidance and support at no charge to them, that they use the name as the main name of their practice, and that is because of the goal of building a national brand. The process is pretty basic, and I won't go into too much detail right now, but it starts with an initial exploratory call. We talk about the stage of the project for the group and also what we can offer them, and then confidentiality, affiliation agreement, bishop's permissions. And then we start working with them, and it really is providing them with very personalized guidance as they go through the startup process and then operations. So we conceive of it as existing to do whatever it takes to help make a national network, a national care delivery network available so that patients have access to these alternatives. And then secondarily, actually to create a brand that can evangelize the culture. And I know putting that sentence up there, I know we have a mixed audience here. Most people are very passionate about Humanae Vitae, but when you start talking about evangelization in medicine, I think people begin to squirm. And the reason I think that actually is partly because of my experience in medical school. I can't tell you the number of times that I would say to an attending physician or a teacher, you know, I'm Catholic, my faith is really important to me, I don't want to prescribe birth control. And their response would be, are you going to tell your patients that they're going to hell? I mean, more than once, repeatedly. And I always thought, where does that come from? Who would think that? But there was this idea that when we bring faith into the conversation, we're going to be proselytizing. And that's not what I'm talking about. And that's what I'm going to go into now. So, again, we made the choice to be Catholic partially for those reasons I listed above that have to do with our sense of our calling as Christian physicians, Catholic physicians. But there was a second reason, and that has to do actually with the goal to build a brand that people recognize as Catholic. And I think there are three main reasons we think there's a value in creating a national Catholic healthcare brand. The first being that brands build trust, or at least have the potential to. I'll talk about that. Just by virtue of existing, actually, I think a brand has the potential to evangelize. And then this idea of creating a tipping point on the exact things that we've been talking about this weekend. And that idea of a tipping point, I'm not an expert, I'm not a marketing expert, but this seemed so relevant to me when we were doing our planning. Innovations, including ideas, spread through a society in a very predictable pattern. And if we pay attention to that, it guides how we communicate our message most effectively. But let me start with creating trust. A brand, of course, can be a name, a term, a design, a symbol, something that distinguishes a specific organization or product from its rivals. I like this definition, which was from an article from Forbes. A brand is what your prospect or patient thinks of when he or she hears your brand name. It's everything they think about it, both factual and emotional. So the brand name, the logo, whatever it is something that exists objectively, but the brand exists only in someone's mind. So it's this objective thing that is able to evoke a very specific emotional and intellectual response. And the benefits, the listed benefits when you look at marketing, literature, customer recognition, competitive edge in the market, easy introduction of new products, customer loyalty and shared values, enhanced credibility and ease of purchase. Well, I know this is all marketing lingo, but think about it. This is what we're trying to do. We're trying to introduce a new product into a market that is not familiar with it, right? Fertility care-based women's health. A brand having the ability to create customer loyalty and shared values. As I get into this, I think we see this in our patients. There's this profound loyalty because they share our values that actually helps us to spread the goals of this work that we're doing. And then credibility, enhanced credibility. So again, we are introducing something new into a culture that is either not aware of it or really, quite frankly, very suspicious of it, right? What we are doing is quite countercultural. And so what if there was a tool, what if a brand could be a tool just to help with some of those pieces? Now, how could it work? So again, fascinating book, highly recommend it. I thought it was really interesting, called The Human Brand, How We Relate to People, Products, and Companies. They talk about this idea that consumers, in our case patients, respond intensely to two qualities associated with a brand. Now this was really interesting. It's this idea that kind of evolutionarily, we react to people when we first meet them in a split second on a subconscious level based on these two qualities, warmth and competence. So Dr. Brahaney is a stranger. He's walking towards me. In a single instant, I decide, is he coming to help me or hurt me? Warmth. And how likely is he to be able to do either of those things? Competence. And so if the person is emanating warmth and competence, we're drawn towards them. We feel safe. We relax. It's attractive. When people are warm but incompetent, we pity them. If they're cold and incompetent, we hate them or annoyed by them. And if they're cold and competent, we fear them. Right? Cold, they want to hurt us. There's like this split-second judgment. And this author makes the case that we actually relate to brands in the same way by the image that they have created. And I thought, gosh, that's like completely true. I love Amazon. I push a button on my phone and 2 days later, it's like my fairy godmother delivered a present to my front door that I can unwrap and, I mean, I know that sounds very superficial, but this is kind of the reaction we have to Amazon Prime. They're warm, I want something, they give it to me, and they're competent, it's delivered. We react to this brand. Verizon, I keep feeling I should not say this in public because I'm going to get in trouble, but I hate Verizon. I have a problem, I call them, they don't care, and they can't help me. Right? That's what I think of with Verizon. I mean, this was so interesting to me, and I thought, oh my goodness, we have the jackpot if this is what's true. Because our doctors are the epitome of warmth and competence. I mean, think about it. You've heard them speak. And that, I think, is the main reason we see this intense loyalty from our patients. And our patients become the strongest promoters of the work that we're doing. So I put up here These are one of dozens, if not hundreds, of reviews of some of our doctors in our Gianna network. I know every NAPRO doctor in this room actually could have quotes that are exactly the same. But I mean, listen to me. Oh, I can't quite see it, but so the top right-hand corner, this is our affiliate in New Jersey. I've been going to Morningstar for a year. It's a bit of a hike, but I believe it's worth it. I really think the people that work there actually care and are really trying to help the people that go there. If you are in Pennsylvania, New Jersey, New York, or even Delaware, Delaware is 4 hours away from this practice. But this patient is saying, if you live within 4 hours, I highly recommend that you make the trip to this amazing office. It takes me an hour more to get there, but I'm still going because I think they're that good. Next one, Dr. Carpentier, he'll speak later. He'll be speaking about creating value in healthcare. Dr. Carpentier could not be more caring, gentle, thorough, or holistic. I highly recommend him to anyone. He spends an extraordinary amount of time with each patient. He strives to find root problems in healthy treatments. He sees the whole person. And for those struggling with infertility, this makes all the difference. Dr. Patterson is attentive and thorough and genuinely caring and takes her time to really know and understand you and your history. I have seen many doctors over the last few years, and none of them seem to care about their patients like she does. I have never met or known a doctor like her, and I am so grateful that God directed my husband and I to her office, our Kansas affiliate. You will not find better care anywhere else in Kansas City. She's one of the most caring doctors I've ever met, Dr. Pritchett. She not only takes the time to listen, but is intent on treating the whole patient, not just the ailment. I cannot recommend her more. If you choose this practice, you will be in the care of the best hands. And our last one, Dr. Biter, he's our NAPRO surgeon in New Jersey. My experience with Dr. Biter was nothing less than excellent. He's caring, ethical, innovative, and brilliant. After going to many other doctors and none being able to get to the root of my problem, I then decided to contact his office. That was one of the best decisions I've made in my life. That's how life-changing my experience with him was. There are no other words to describe him than simply amazing. This is not just like, oh, it was a good doctor's visit, I highly recommend them. This is like, this was an experience. These people don't just post the reviews, they go and they tell everyone they know about how amazing the experience they had was. I mean, I have one patient, she came, young woman, not infertility, not sexually active, no medical problems, just a GYN exam. She came in, she was so excited to be able to come to a Catholic practice where she could ask questions without being judged. She was a young Catholic woman. And she left and told every single person in her office over and over and over again, you should go to this doctor. And they come. I literally take care of every woman in her office. And none of them are Catholic. And when they get there, because they have been primed by this woman whose mission it is to get people into our office, they don't care, they're not offended, and they get great care, and then they tell other people. Now, what if we could harness this and put all of this amazing good feeling behind a brand so that across the country, anytime someone saw this brand, they thought, this is a place where you go for amazing health care, where the doctors deeply care and are deeply knowledgeable. And they're Catholic, and I think they are. I think that way of being comes from them being Catholic. I would actually even say it doesn't have to be my brand. I just think it has to be a brand. But this is what I mean by creating trust. When these patients walk in who are not Catholic but have been prepped by someone who's had such a good experience, they're very receptive to what we have to say to them. Second point, building a brand not to proselytize, to attempt to convert someone, but to evangelize. We are called to evangelize at every single moment of our day and our life. And we love myself and many of my Catholic friends love the quote from St. Francis, preach the gospel always, and if necessary, use words. It does not mean that our patients are coming in and we're sitting down with them and asking them, when was the last time you went to confession? It means that when they come in, we treat them with a profound reverence because of who we are and what we believe about their dignity. And we listen as we are sitting with them. For a moment, the Holy Spirit might provide to speak. Sometimes it comes, sometimes it doesn't. But the fact that they come in, they're loved and cared for, and they know we're Catholic, that speaks volumes to them. And I think that has a value that we cannot deny. But with it being the case that we see patients who are Catholic and not Catholic, and we've made a choice to be Catholic, we do have to be conscious of the fact that we have different audiences and that different languages resonate with them at different times. So our Catholic patients come because we are explicitly Catholic. They're profoundly relieved to be able to speak freely about their own faith. Many of them travel for hours to come to a center. You've heard that from several of the doctors. These are the ones who become our strongest and most vocal supporters. And I really feel like above everything else, we need to shape what we do to serve them well. And then our non-Catholic patients come for a variety of reasons. For some, it is ethical. They don't want to do IVF because they don't want to destroy embryos, whether they're Catholic or not. Some just want natural treatment. Some are looking for that correction for an underlying health problem. Some just want to understand their bodies and their fertility cycles. Others really don't want to be put on hormonal contraceptives or have devices inserted in their bodies, or because they have risks. And these patients, again, if we, in a spirit of charity, are careful about the language we use, they feel welcome. There's a small percentage of patients who will not come to us. They're the ones standing outside of Planned Parenthood wearing, the vest and ushering the women in. No matter what, when they hear we're Catholic, they're not going to come. But everybody else, we have not seen it be a deterrent. I won't go through this because I kind of just said it without reading it. So again, the correct language for the correct audience, always looking at it from the perspective of a humble, discerning accompaniment based on demonstrating the same love that Christ demonstrated. Willingness to pray if the patient wants it. In my first visit with patients, I say, is there a faith tradition that's important to you? If they say yes, I say, would it be helpful to you if we prayed together? Would you like me to say a prayer for you? You don't have to say yes, I won't be offended. And they do. I even had an atheist say, I don't believe in, she actually came in, she sat down, came for recurrent miscarriages. She said, first of all, I just want you to know I believe in absolutely nothing that you believe in. And I thought, that's very interesting because we've never met. But I still said to her, is there any faith tradition that's important to you? She said, no. I said, okay, but I always ask my patients, would you like me to pray for you? And she said, okay, that would be fine. So, but again, I don't think she felt disrespected. She also actually became one of our most vocal promoters. So this is what I mean. This is some of our marketing. It's just basic healthcare marketing. And at the bottom, we mentioned that we're pro-life and Catholic, but it's not in your face. This was developed by our marketing department. I think it's such a cool idea. I really thought that was interesting, erasing infertility. And again, it's all about what we do for infertility. This does not show up. And the very last sentence, the Gianna Center, committed to honoring the sanctity of human life. So again, when I say evangelize, I'm not talking about beating people over the head with our religious beliefs, but kind of this very comprehensive and consistent with our faith way of understanding our identity. My development director hates this poster because he's like, that's the complete opposite of what Humanae Vitae teaches, but I still thought it's cute. And so finally, my final point, this idea of a tipping point, I thought this was really fascinating. A tipping point is a point in time where a group or a large number of group members rapidly and dramatically changes its behavior by widely adopting a previously rare practice. Now, I hate to use this as the example, but this is actually what we've just seen with gay marriage, right? This was like unheard of. And then it just seemed like overnight, it was the standard. And if you didn't support it, there was something wrong with you. It literally happened that quick. It was stunning. That's a tipping point. It's one moment it's not there, and the next moment it is. So it happens in many different things, and it happens in the way ideas spread through a culture. And so I thought, how does this apply to what we are trying to do? So this I take from a book, which kind of gives an overview of this concept called Start With Why by Simon Simonek, and references a theory. I can't believe I'm forgetting on the name of the person who came up with this theory. I'm sorry about that. But basically he says, new innovations, whether it's an item, an object, or an idea, spread through a society in a specific way and involve specific groups of people. So innovators are the idea generators, the small percent, maybe 2.5% of people who come up with something truly new. Honestly, Dr. Hilgers, he's an innovator. He says he's a discoverer, but his education system, this was completely new. Then, the next part of the population, about 13.5%, are the early adopters. These are the people who are passionate early about the new innovation. The book uses the example of the iPhone. These would be the people who every time a new iPhone comes out, they're standing in line in the rain because they want to be the very first person to have it. The passionate, committed followers of that innovation. The early majority, which makes up 34% of the population, are the people who are not averse to new things, maybe not averse to your innovation, but they need to know someone else who's already adopted it before they will adopt it. The late majority, the same. They're not averse to change, but they need to know more people. And then the laggards will never adopt an idea. This would be my husband, who only got a smartphone because there were no other phones available, and our landline died, and when he called the phone company, they said, we don't make the copper wire to replace your landline. So, they're the end. But this conceptualization of the population is really important to understand in terms of who we market to. And I'm going to actually read, it's only about a page long, because he gives this great description of the correct way to win over a population and create a tipping point. So he says, there's an irony to mass market success. As it turns out, it is nearly impossible to achieve mass market success if you point your marketing and resources to the middle of the bell. If you attempt to woo those who represent the middle of the curve without first appealing to the early adopters, it can be done, but at massive expense. And this is because the early majority, Everett Rogers is the name of the person, the early majority will not try something until someone else has tried it first. The early majority, indeed the entire majority, 70% of the population, need the recommendation of someone else who has already sampled the product or service. How ironic. It's too funny. It's what I spend most of my day talking about. They need to know someone else who has tested it. They need that trusted, personal recommendation. According to the law of diffusion of innovations, mass market success can only be achieved after you penetrate between 15 to 18% of the market. That's because the early majority won't try something new until someone else has tried it first. The ability to get the system to tip is the point at which the growth of a business or the spreading of an idea starts to move at an extraordinary pace. It is at this point that a product gains mass market acceptance, and the point at which an idea becomes a movement. When that happens, the growth is not only exponential, it's automatic. It just goes. The goal of business then should not simply be to sell to anyone who wants what you have, the majority, but rather to find the people who believe what you believe. The left side of the bell curve, they perceive greater value in what you do. They are the ones who, on their own volition, will tell others about you. That 15 to 18% is not made up of people simply willing to buy your product. It is the people who share your beliefs and want to incorporate your ideas, your products, your services into their own life. No matter where they sit in the spectrum, these people not only love you, but talk about you. You get enough people on the left side of the curve on your side, and they encourage the rest to follow. If you have the discipline to focus on the early adopters, the majority will come along eventually. So what's our innovation? I actually think this teaching of Humanae Vitae is the innovation. I mean, one of my friends, actually, she's the co-founder of these two groups I've talked about, the Gianna Center and our education nonprofit called the John Paul II Center. She said, one of the beautiful things in the rejection of Humanae Vitae is that our current generation doesn't reject it because they have never heard it. It is a true innovation. But how do we get that innovation to spread? This is where I make the case that we have to, that's not good. We have to focus on the early adopters as opposed to the middle of the curve. And who is that? These are Catholic women and families, the ones I've been talking about during this whole talk. To me, this is a marketing reason to really focus on meeting their needs and serving them well, because they are the ones who in their communities help to create this movement. And the goal of focusing on them with a language that doesn't alienate anybody else is reaching the everybody else. And then my final two slides, why one Catholic brand? One of the reasons is just really simple and practical, and that is that there just are not a lot of Catholic doctors doing women's reproductive health that are faithful to the teachings of the church. So if we want to have this mass market effect of a brand that people associate with these amazing things, we need to use those resources well. And I just think, again, imagine the impact of a brand in healthcare that people recognize with everything that we've been talking about in these past 2 days, how that could change the perception of healthcare. If in every community, people just knew there's the conventional way of doing healthcare and there's this Catholic way, but it's amazing. Imagine the dialogues that would start. So I close with the words of John Paul II in Evangelium Vitae: to all the members of the church, the people of life and for life, I make this most urgent appeal, that together we may offer this world new signs of hope and work to ensure that justice and solidarity will increase, that a new culture of life will be affirmed for the building of an authentic civilization of truth and love. I think the work that we are all doing here is one of those new signs of hope. Thank you.